Yes, I can start maybe with a few words about Réunion Island, because maybe you don't know where is this island. It's just between Madagascar and Mauritius. It's a French overseas department. It means that you could live there like in Paris, but without strike usually, and with sun every year. And we have nice mountains. The summit it's at 3,000 meters, and we have nice mountain, nice waterfall. It's a UNESCO heritage. We have an active volcano. We have very nice wave for people love surf, but unfortunately we had some shark attack. But now, no worries, guys. We fix it. Since 5 years, we don't have any shark attack. For people who are crazy about ultra trail, we have 100 miles across the Réunion Island in October each year. And maybe you know Réunion Island because of this massive chikungunya outbreak 20 years ago, and it was a devastating outbreak. I would like to speak about these three clinical cases. Of course, you know that I'm going to speak about arboviroses, but the first one is dengue. Dengue, it's an arboviruses. You have 4 serotypes, dengue 1, 2, 3, 4, and we estimate that cover 100 to 4 million infections per year. The transmission is by Aedes mosquitoes, and it could be Aedes aegypti or Aedes albopictus. It's during the daytime. It's not during the nighttime like for Anopheles. And it's mainly on the urban area, and it's a contrast with the Anopheles too. The thing interesting is that the infections induce immunity against the serotype, but not for the others. And to contrast, it's facilitating antibodies. It means that after the first dengue that you have, you declare, finally you will have a more severe form the second time or the third time. And the thing very difficult is for often people, they are asymptomatic, and it's very difficult to know which part of the population finally were asymptomatic, and you don't know when you do the dengue if it's going to be the first one, the second one, if you don't do any serology. About Réunion Island, we had a massive outbreak of dengue between 2018 and 2024. You could see that we confirm around 70,000 cases. Of course, it's only people they done the serology or the PCR, but many people in the family, because I know some of them had the dengue, they didn't do the serology or the PCR. And we say maybe we could be without dengue and without arboviruses for a few months or few years, but finally you will see that in 2025, this year, we have another massive outbreak of chikungunya. This slide, I'm sorry, it's quite small, but it's to show you from through a prospective study that we did in 2019, that it's not only a flu-like syndrome. You have fever, yes, but you could have abdominal pain, you could have nausea, you could have cough, you could have paresthesia, and it's difficult for people, for physicians, when they don't used to manage some type of disease like this. And at the beginning, we're starting to hospitalize many patients, but after a few months, after a few years, after a few outbreaks, finally we were maybe sometimes more aware about which type of patient could have a severe form. And something very interesting, it's you have a very nice document with the WHO, but most of the study were in the country where they have endemic arboviruses. And finally, when you look on your population who weren't endemic before 2018, we could see that the warning sign wasn't adapted in Réunion Island in a place where we were not endemic area. Why it's important? Because in Europe, you're not endemic area, but you will maybe one day become an endemic area, and the signs that you will see on the WHO when you will be at the emergency unit with your colleague, they call you for a rash or something like this, you will say, okay, what they say, okay, maybe we have one warning sign, this one I'm going to take it to my ward, but finally, you could see that this is not the case, and it was difficult to focalize about the warning sign, and we decided to, at this time, to use 2 warning signs from the WHO. About the skin rash, something very typical of dengue. It's not only dengue that you could find something like this, but it's the white spot in the Red Sea. We performed in this prospective study the complete examination of all the patients, 163, and you could see that you could have many different expression of the skin with arboviroses. It could be pruritus, mouth involvement, macular rash, hyperesthesia, gingival diffuse rash, purpura, conjunctivitis, edema. Sometimes you could have vesicular rash, alopecia. Often it was after 2 or 3 months, and sometimes bullous rash. The other thing interesting is we try to collect retrospective data. It was on 847 patients, and we performed some multivariate analysis. And what we notice is finally people with a rash, finally they are younger, and they don't have any comorbidities like diabetes, for example, but they have a massive flu-like syndrome with eye pain, dizziness, and often they need more rehydration. What means it's maybe when you are young, you have a better immunologic system, and you will fight better against the arboviroses. And finally, you have more expression on your skin, and maybe you could do less severe form. We couldn't prove on this multivariate analysis, but it was interesting because in contrast, for example, elderly people, they have no rash, and often they have dyspnea, and it was very difficult for my colleague in the emergency unit to imagine that it could be dengue. It wasn't with any bacterial pneumonia or something like this, and you just be aware about it. Something to keep in your mind about dengue, it's the thrombopenia, the low platelets that you could have, not at the day 2, not at the day 3, but between the day 5 and day 7. And it means that when you see the patient the first time at day 2, day 3, after a few days of fever and a rash, you couldn't imagine, if you don't know, that they could decrease the platelets after a few days. And it could become very dangerous because when you have 20 giga per liter or 15 giga per liter, you do a blood test and you could have a huge hematoma like on this man. The other thing that you have to be aware, it's about organ failure, plasma leakage, and the other severe hemorrhage. Okay, the first guys was dengue. Just be aware about the hemorrhage, epistaxis, for example, or purpura in the mouth, and I think you could manage well your patient. The second one is chikungunya, and as I said, we think, oh, maybe that's okay now. We are on holiday, a good sun, a good wave, and now we will stop to have dengue, but no. 20 years after, we got another outbreak of chikungunya. It was this year, and it's quite similar about the symptom. Something but very specific about chikungunya, it's the arthralgia. It's massive arthralgia and the chronic arthralgia. Just to know that chikungunya, it means bent man in Tanzanian languages. And it's the same vector with Aedes aegypti and Aedes albopictus. And something I didn't say about the dengue, and it's the same for all arboviruses. Keep in mind that we don't have any treatment. It's only symptomatic treatment, and use hydration. Hydration during the acute phases is very, very important. We proved on the outbreak of Martinique 10 years ago that when people get a good hydration at the beginning of the arboviruses, they could have less complication or less chronic form. For chikungunya, and for chikungunya, it's very important because you will have chronic chikungunya. You could have chronic chikungunya. About the epidemiology, It's starting in 1954. The first description was in Tanzania, as I said, in Reunion Island in 2005 and 2006. And after, we starting to see chikungunya in Europe, like in Italy, for example. And this year, we have more than 50,000 confirmed cases. We estimated that we have more than 200,000 patients that we had the chikungunya this year. With 500 hospitalization. And you could see that we noticed some cases around our island with Mauritius, with Mayotte, and we noticed in France mainland more than 8,800 imported cases, and we started to see some autochthonous cases in France mainland during this summer. And the other number is 10,000 people had chikungunya in China. Something very interesting, it's a map of WHO in 2022. But you could see that, of course, the chikungunya is more in the tropical area, but France is in the purple color with Italy because of imported cases, but now autochthonous cases. And what you have to keep in mind, it's the vector of chikungunya, this Aedes aegypti, but more specifically in Europe, the Aedes albopictus is not everywhere in the world, but it's now it covers more than 4 billion of people. And for France, for example, if it's work, no. Oh, yes. And for Europe, it's a map of in 2025 that you could see we have Aedes albopictus in Spain, in Italy, in Greece, and many countries in Europe. And in Paris, we have Aedes albopictus. Just stay with us until 9 p.m. like this. You can bite by the mosquito tonight because we still have chikungunya in Paris. Just a few words about prevention. We have vaccination depending of the arbovirus, and we have some people using vector control. Of course, you have the mosquito repellent spray, and you have to eliminate standing water. And the last thing, of course, you have the mosquito net. It's my daughter. She was very sick with the chikungunya, and we tried to avoid that some mosquitoes, they could bite her and after bite us, but finally it didn't work because all the family did the chikungunya this year. I'm not going to speak about Zika, but just keep in mind arthritis with chikungunya, blood or epistaxis, hematoma with dengue, and it's conjunctivitis, and be aware about the pregnancy for people affected by Zika. Thanks for your attention, and if you are interested to come to our island, you're welcome.